I'm Liz Harte. I'm a clinical psychologist. I'm working with staff in the Royal London Hospital Emergency Department and London Air Ambulance and Physician Response Unit. So I was redeployed during the pandemic just to support staff. So I have a very unusual and wonderful role here, listening and working with the staff and creative ways to meet the needs here. So delighted to join you all. Really enjoying the morning. So I'm in a very privileged position as a psychologist to have more time to listen. And I know that staff across, I used to work in primary care. So I was redeployed I was working within Poplar and Limehouse general practices on a pilot project, working with people with poorly controlled COPD mainly, and then branched into type 2 diabetes. And I know from working with the staff there was huge just exhaustion with that what their patients then, but also them as why they went into that role. It's not a position anybody wanted to be in, to have no time for the people you're there to care for. So I had the opportunity through that work with a little budget on a pilot project. And I know pilot projects have lots of problems in and of themselves. But Chantal was on the call earlier with from Accelerate. She used to be in the personalised budgets team. We managed to set up a Singing for Lung Health group within the practices locally, and that was incredible. Just like that video that we saw earlier, just pure joy to see people come together and create a little community and a family. We managed just about to get about a third of that group online when the pandemic hit, and they described that as their lifeline. They still join and sing online once a week through that personalised group pooled budget. We also did some wonderful work with some Bangladeshi women through group care planning for people with type 2 diabetes, and that was in Chris Street practice. We had the part 2 of their yearly care plan as a group, and they came together, and there was like do you think it's higher or lower this year than last year, your HbA1c? And in that conversation the women were able to share what they did differently that helped, or what they did differently that they noticed didn't help. And they then got to go as a group, as a team, to Good Moves, which is led by Social Action for Health, that we held at a GP practice. We timed it so that they could go across together as one team. And they spoke about even things like, they would love to walk, but they don't feel safe in their communities. A few of them formed their own walking group. And what I think was key in that role is that I had time that others didn't. So the nursing staff and the GPs didn't have that time. They had so many ideas, so many desires to do that kind of thing, but we're just so overburdened with the workload. So just having a bit of a helping hand and the ability to go out and look at what was available in the community and join the dots allowed me to do that. So that was wonderful. So since being redeployed, I've been working in the emergency department here with the staff and trying to really apply the same strategy, in that just sitting down and listening, trying to understand what's working, what's not working, and empowering staff, and then trying to bring some change that helps with that. So during the pandemic, it offered a little window of opportunity where we could actually bring staff together in a room with masks to listen to them. So we had this big ED feedback project. So I was able to gather teams and listen and hear based on themes, what they found most difficult and most challenging, and then the senior leads were able to act where they could, or at least acknowledge that what was difficult. And around that time as well, we had those awful events of Sarah Everard and George Floyd being murdered. And one of the actions that the staff called for was more work around diversity and inclusion. So we had on the back of that a women's listening event. So the female staff members gathered and described their experiences of violence and aggression within their working lives, and we gathered the themes from that. And one of my colleagues, Ben, and this was all had to be very sensitively done, to separate. First of all, there was some raised eyebrows about having women's only to what we should do with that. So one of our male consultants was really an ally, and he held a feedback loop session with men, describing what the themes were from the women's listening groups. And then we had a joint session, and it was really powerful what came from that, and to hear women describe what unfortunately were a lot of shared horrible experiences, and we brought about some change from that. And we also created a local diversity and inclusion team, so they're passionate nursing staff who don't get paid for that work, who don't get extra time, and they developed a set of sessions that address some of the needs both of the staff and of the community. So they developed, this is all from them. So the sessions cover what is racism and discrimination, how to challenge and prevent it, what are the skills that promote inclusion, what are healthcare inequalities, and how to employ anti-discriminatory practices, looking at domestic violence and honor-based violence, gender equality, pediatric diversity, inclusion, communication, and celebrating internal diversity in our local communities. So we run once a month, and it creates lots of discussion. And for example, one of the discussions that came was when we held a group during Islamophobia Awareness Month, and the staff described their upset at attending Prevent training. And since that, I've been able to, in my position, help and support staff to have that voice listened to. That training, the way it's provided at the moment, is offensive and is out of date and needs to be reviewed. And we've met with NHS England's security team, and next week we'll be meeting with the Barts Health safeguarding team to further discuss that and recognise that something needs to change. So yeah, I just that's my little brief, but it's similar to yourselves, just this desire to do something slightly different, and what can come from that is quite outstanding.